My name is Steve Borstein. I'm a doctor of pharmacy and former hospital pharmacist, and today I'm excited to talk about psilocybin, the active compound in what are commonly called magic mushrooms. This compound has potential therapeutic applications that are truly amazing. Before we dive in, I want to be clear. This video is educational and focuses on legitimate medical research. We're not discussing recreational use, and nothing here should be considered medical advice. So what exactly is psilocybin? From a pharmaceutical perspective, psilocybin is a naturally occurring psychedelic compound found in over 200 species of mushrooms. When ingested, it's converted in the body to psilocin, which interacts with serotonin receptors in the brain. That's the same neurotransmitter system affected by many antidepressants, but psilocybin appears to work in a very different and sometimes faster way. Now, psilocybin is currently classified as a Schedule I substance in the United States, meaning it's federally illegal and classified as having no accepted medical use. However, and this is important, that classification is increasingly at odds with emerging clinical evidence. So let's talk about what the research actually shows. Over the past decade, we've seen rigorous clinical trials from respected institutions like Johns Hopkins, Imperial College London, and many others. One potential use where it seems to show significant benefit is treatment-resistant depression. Multiple studies have shown promising results for patients who haven't responded to conventional antidepressants. Some trials have demonstrated significant clinical reductions in depressive symptoms that persist for weeks or even months after just 1 or 2 doses that are administered in a controlled therapeutic setting. Studies have also shown benefits in end-of-life anxiety. Research in cancer patients facing terminal diagnoses has shown that psilocybin-assisted therapy can significantly reduce anxiety and existential distress, improving quality of life. Early studies in obsessive-compulsive disorder and cluster headaches also show potential benefits for these 2 diseases. PTSD, while another drug, MDMA, has been in the spotlight, psilocybin has also been studied for post-traumatic stress disorder. Researchers believe that its ability to rewire brain connections and soften traumatic memory patterns could provide lasting relief. Addiction treatment. There's emerging evidence for it in addiction treatment, including alcohol and tobacco dependence, with some studies showing substantial increases in abstinence rates. Now, before we go any further, it's crucial to understand these people aren't just taking magic mushrooms at home recreationally. These are controlled clinical trials with medical supervision, psychological support, and careful screening. From a pharmacological standpoint, we're still understanding exactly how psilocybin produces these therapeutic effects, but leading theories suggest that it might do the following: increase neuroplasticity, helping the brain form new neural connections, disrupt rigid thought patterns associated with depression and addiction, and promote what researchers call psychological flexibility, which basically means it creates meaningful psychological experiences that facilitate therapeutic breakthroughs when combined with psychotherapy. In fact, brain imaging studies show psilocybin decreases activity in the default mode network. That's the part of the brain tied to rumination and critical self-thinking. At the same time, it increases communication between brain regions that usually don't talk to each other. Many scientists describe this as a reset of rigid thought patterns. This isn't like traditional psychiatric medications that you take daily. The research model involves 1 to 3 sessions with extensive preparation and integration therapy before and after. Now, as a pharmacist, I have to emphasize safety considerations. While psilocybin appears to have a relatively favorable safety profile compared to many substances, it's not without its risks. Psilocybin can cause powerful hallucinations, confusion, or panic if taken in the wrong setting. It also has the potential for cardiovascular effects and drug interactions. In some patients with a history of psychosis, it can also worsen symptoms. And again, I want to emphasize, in most countries, including the US, psilocybin remains illegal outside of approved research studies and tightly regulated therapy programs. When taking psilocybin, there's also the importance of what's called set and setting, and you hear this a lot with this type of therapy, meaning the environment and psychological support matter enormously for both safety and outcomes. This is why self-medication is dangerous and why proper medical supervision is essential. The regulatory environment is also evolving. States like Oregon and Colorado have already legalized psilocybin for therapy services, not for recreational use, and several cities have decriminalized possession. The FDA has granted breakthrough therapy designation for psilocybin-assisted therapy for treatment-resistant depression, which expedites the development and review process. So we may see FDA approval for specific indications within the next few years, which would be a significant shift in how we approach mental health treatment. If this is approved, it would likely be administered in certified clinics by trained therapists and likely not available in your pharmacy or local dispensary. All right, there's at least one pharmaceutical company at the time of this video that has a drug derived from psilocybin in clinical trials, so that's also exciting. If you're struggling with depression, anxiety, or addiction, what should you know? First, don't self-medicate. The therapeutic protocols being studied involve much more than just the compound itself. The psychological support that comes with the therapy is crucial. Second, talk to your healthcare provider about current treatment options. While psilocybin therapy may become available in the future, there are many evidence-based treatments available now. Third, if you're interested in clinical trials, you can search clinicaltrials.gov for studies recruiting participants. This gives you access to cutting-edge treatments with proper medical supervision. The research into psilocybin represents what I think is truly an exciting frontier in mental health treatment. As a pharmacist, I'm cautiously optimistic, but I also recognize we need more data on long-term outcomes, optimal protocols, and an idea of which patients benefit most. The key takeaway is that there is legitimate medical research showing real promise for psilocybin, but it's still research. We need to let the science guide us, ensure proper safety protocols, and maintain the distinction between therapeutic use in controlled settings and recreational use. I'll put links in the description to some of the studies for anyone who's interested. And what are your thoughts? Have you been following research? Let me know in the comments below. And as always, if you found this information informative, please like, subscribe, and hit that notification bell. Thanks for watching.